Hi everybody, I am Dr. Indranil Saha. My specialty is high-risk pregnancy and infertility. I practice at Bhagirathi Neotia Women and Child Care Center at Rawdon Street and Newtown, Kolkata. Now we all know that pregnant women can take their COVID vaccines during their pregnancy. So today I'll discuss what are the informations you need to know before you take your COVID vaccines. Are there any side effects of COVID vaccine? What are the precautions you have to take after you take the vaccines? And how to book your slot for the COVID vaccine? If you have any further queries, please write to us and we'll try to clear your doubts. Thank you.
Why is COVID-19 vaccine been recommended for pregnant women? Though pregnancy does not increase the risk of COVID-19 infection, and most women will be asymptomatic or have mild symptoms, but their health may deteriorate rapidly and that might affect the fetus too. It is therefore advised that pregnant women should take COVID-19 vaccines. How does COVID-19 affect the health of pregnant women? Although more than 90% infected pregnant women recover without need of any hospitalization, rapid deterioration in their health may occur in few. Symptomatic pregnant women appear to be at increased risk of severe disease and death. In case of severe disease, like all other patients, pregnant women should also need hospitalization. Pregnant women with underlying medical conditions like high blood pressure, obesity, age over 35 years are at a high risk of severe illness due to COVID-19. How does COVID-19 infection in pregnant women affect the baby? More than 95% newborns of COVID-19 positive mothers have been in a good condition at birth, but in some cases, COVID-19 infections in pregnancy may increase the possibility of premature delivery. Baby's weight might be less than 2.5 kgs, and in rare situation, baby may die before birth. Which pregnant women are at higher risk of developing complications after COVID-19 infections? Pregnant women who are older than 35 years of age, high BMI or obese, have a pre-existing illness such as diabetes or high blood pressure, have a history of clottings in the limbs, are high risk if they have COVID infection. If a pregnant woman has already had COVID-19, when should she be vaccinated? In case a woman has been infected with COVID-19 during current pregnancy, then she should be vaccinated soon after delivery. Are there any side effects of COVID-19 vaccine that can either harm the pregnant woman or Are there any side effects of COVID-19 vaccines that can either harm the pregnant woman or her fetus? The COVID-19 vaccines available are safe and vaccination protects pregnant women against COVID-19 disease like other individuals. But like any medicine, a vaccine may have side effects which are normally mild. After getting a vaccine injection, a pregnant woman can get mild fever, pain at the injection site or feel unwell for 1 to 3 days. The long-term adverse effect and safety of the vaccine for fetus and child is not established yet. Very rarely, the pregnant woman may experience the following symptoms within 20 days after getting the COVID-19 vaccination, which may require immediate attention. These symptoms are like shortness of breath or difficulty in breathing, chest pain, persistent abdominal pain with or without vomiting, pain in limbs or pain on pressing the limbs or swelling in the limbs. It can be either the arm or the calf, small pinpoint hemorrhages or bruising of the skin beyond the injection site, weakness, paralysis of limbs or any particular site of the body, seizures with or without vomiting, severe or persistent headache with or without vomiting, persistent vomiting without any obvious reason, blurred visions or pain in eyes, any other symptoms or health condition which is of concern to the recipient or the family. In these cases, the pregnant woman has to contact her doctor. What other precautions need to be taken after a pregnant woman gets vaccine? In order to protect themselves or those around from spreading the COVID-19 infection, a woman should wear a double mask, practice frequent hand washing, and maintain physical distance and avoid going to crowded place. How does a pregnant woman register herself for COVID-19 vaccination? All pregnant women need to register themselves on the CoWIN portal or may get themselves registered on site at the COVID-19 vaccination center. The process of registration for pregnant women remains the same as of general population, and you can take the government help for that. One thing we have to mention you that you cannot get COVID-19 infection just from vaccination.